Ewing sarcomas are rare but very aggressive bone tumors occurring mainly in children and adolescents. The exact cause of the disease and the cell of its origin is unknown. Ewing sarcoma is a fatal disease in desperate need of novel treatment options to improve outcome. Without appropriate treatment, this life-threatening tumor grows and spreads very quickly, preferably to the lungs. Therapy has not significantly changed for years and usually involves chemotherapy, surgery, and if applicable, radiation therapy. Whereas the disease has a relatively high cure rate if no metastases have been formed, the survival rates in the metastatic stage are still very low. A major obstacle to new drug development is the incomplete knowledge of tissue origin of this cancer and therefore the lack of appropriate preclinical models for research. The goal of Professor Heinrich Kovar's research group at St. Anna Children's Cancer Research Institute is therefore to elucidate the cell of origin of these tumors, to understand how metastases form, and to identify potential targets for new and more effective drugs against this disease.
The major threat to Ewing sarcoma patients is the development of metastases. Metastasis is a multi-step process. The transition from one step to the next step requires plasticity of the tumor cells, a characteristic which is not de novo developed by the Ewing sarcoma tumor cells, but something that is most likely derived from the tissue of origin, which in the case of Ewing sarcoma we don't really know. In order to study the plasticity of the tumor cells, we are generating models using candidate cell types of origin. In the case of Ewing sarcoma, these would be mesenchymal stem cells, and model organisms such as the zebrafish, and study the different steps of the normal differentiation process, and then introduce the major genetic aberration that drives the disease in order to perturb this differentiation. We're going to use these models to perform high throughput screenings for novel compounds that would specifically target the metastatic process, both in Ewing sarcoma as well as in other sarcomas. These novel compounds are highly needed in order to treat patients with metastases in Ewing sarcoma, as so far the prognosis of those patients with conventional therapies is still dismal.